Dr. Christian Augustin with Bayside Chiropractic and Rehab. And I wanted to get started by asking you a few questions. The first question would be, do you ever wake up and you're stiff? Or do you wake up every day and your low back is stiff or your neck is stiff? Do you ever have leg pain or what's known as sciatica? Have you been diagnosed with a disc herniation or degenerative joint disease, or some people call it degenerative disc disease? Or have you heard the words disc bulge, slip disc, or any of those things? Then I wanted to discuss a little bit of a different type of therapy with you today. The therapy is known as decompressive therapy. Decompression is basically the act of mechanical traction to either your neck or low back with a computerized system for traction and release. Now if you look, this is a regular decompression table. So we have the computerized pulling module here, and then we have a table that basically flexes and moves in all different types of positions. Most people are very relaxed, so if you've been diagnosed with one of these ailments, sciatica, disc herniation, spinal stenosis, Facet syndrome, degenerative joint disease, degenerative disc disease, the list goes on and on. But they're all describing a very similar situation in your low back. And a lot of people suffer a lot of leg pain, arm pain, if it's in your neck, from these conditions. So how we treat it with the decompression table is that we set you up on the table, whichever way is most appropriate for you. If you're on your stomach, on your back, you can raise and lower it. And then we do a 20-minute to 25-minute pull on your lower back, where the computer pulls and releases over that time to help with lower back pain. A lot of people go through regular physical therapy, which is great, and they go through things, and then they wind up at an orthopedic surgeon's office, and a lot of times, they're looking at a possible lower back fusion, a cervical fusion, or a different kind of surgery to try to help with this condition, and they've never ever done decompression. Well, recently I pulled a study out of Spine 2011, and the study was done by actually the University of Cincinnati School of Medicine. And what they did is they went back and looked at 1,450 patients that had low back diagnosis of disc herniation or degenerative disc disease or sciatica or radiculopathy. Out of those 1,450 people, half were treated with surgery, half were not treated with surgery and proceeded to do conservative care. Out of the people treated with surgery, it was found 2 years later, only 26% had returned back to work. Out of the people that weren't treated with surgery, specifically a lumbar fusion, 67% returned back to work. So it actually showed that low back surgery, and the conclusions the doctor made, was that low back surgery is actually ineffective in treating, specifically fusion of the low back, was ineffective in treating these conditions. They also found out that the people that had surgery had a 41% higher rate of usage of opioids, which are your pain medications. So specifically your narcotics. So before you go for surgery, I would recommend that you look at decompressive therapy. You can call our office. Again, it's Bayside Chiropractic and Rehab in Fairhope, Alabama. Our office number is 251-990-8388. If you have any questions, I'll be more than happy to talk to you. Thank you.